In terms of wearing a mask, our advice is clear that wearing a mask if you don't have an infection really reduces the risk almost not at all. So we do not advise that.
A few weeks ago, if you looked for papers, policy papers, research papers saying whether masks were a good idea, there were several announcements and papers, some of which have disappeared from their positions on the net, which were hostile to muzzles.
Yeah. There is no evidence that general wearing of face masks by the public who are well affects the spread of the disease in our society. But in terms of the hard evidence and what the UK government recommends, we do not recommend face masks for general wearing by the public.
I mean, the evidence on face masks has always been quite variable, quite weak, quite difficult to know exactly, and there's no real trials on it.
When the evidence around the use of masks by the general public, especially outdoors, is extremely weak.
The recommendation from SAGE is completely clear, which is that there is weak evidence of a small effect in which a face mask can prevent a source of infection going from somebody who is infected to the people around them.
Yes.
And there was a statement by the World Health Organization which was definitely against the wearing of muzzles. Now, a few weeks ago, the World Health Organization did a reverse ferret and changed its mind. And Deborah Cohen of the medical correspondent Newsnight on the BBC had an amazing scoop the other day. She actually discovered, and she put it to the WHO, that her contacts inside the World Health Organization had told her that the position of the WHO on muzzles had been changed because of political pressure, not because of medical reasons.
As of Monday, the 15th of June, face coverings will become mandatory on public transport.
We've therefore come to the decision that face coverings should be mandatory in shops and supermarkets.